Hi, I'm Grace Thibodeaux, and I'm going to be discussing the relationship between STIs and infertility. The terms STI and STD are used interchangeably, but STI is becoming more commonly used. Chlamydia and gonorrhea are important but preventable causes of infertility. Untreated, about 10 to 15% of women with chlamydia will develop pelvic inflammatory disease, also known as PID. Chlamydia can also cause a fallopian tube infection that goes without any symptoms. PID in this silent infection in the upper genital tract may cause permanent damage to the fallopian tubes, uterus, and the surrounding tissues, which can lead to infertility. Just like in women, men can also be infertile due to STIs. Some infections can interfere with sperm production or sperm health, or it can also cause scoring that blocks the passage of the sperm. Chlamydia and gonorrhea are two of the main STIs that'll cause problems for infertility for men and women. Here we see scarring in the cervix from chlamydia, which can then lead to infertility. An individual can have an STI without ever even having any symptoms of the STI. Many STIs are spread through skin-to-skin sexual contact. The organisms within STIs can be spread through non-sexual contact, such as blood products or tissue transfers. Since STIs like gonorrhea and chlamydia can cause infertility, the best way to prevent infertility is to prevent STIs. So by counseling and practicing safe sex, individuals can prevent the STI, which can then prevent the infertility. Gonorrhea, chlamydia, and syphilis are generally curable with a regimen of antibiotics. The main way to possibly treat infertility if one does have an STI is to treat the STI. Treating of infertility depends on the cause of the infertility. It may include simple education and counseling. Medicines to treat the infections or to increase ovulation are often used, and also medical procedures such as in vitro are also used. The scoring from the PID from gonorrhea or chlamydia can produce a decrease in fertility and absolute infertility for the woman or the male, or can increase the incidence of an ectopic pregnancy. Symptoms of infertility include the inability to become pregnant. Because of this, a range of emotional reactions by either or both members of the couple are present. Sometimes one or both members of the couple can become depressed. The inability to become pregnant takes a huge toll on both the male and the female in the relationship. The Centers for Disease Control and Prevention estimate that the infections such as gonorrhea and chlamydia cause infertility in at least 24,000 women each year. Louisiana statistics have increased by more than 10% of individuals having an STD. Lafayette has recorded over 1,000 STD cases. For some additional information, I wanted to tell you about the human papillomavirus, also known as HPV. HPV is prevalent in older women as well as younger women, and it can cause cancer in older women as well as younger women. When HPV is found and the precancerous cells or even cancerous cells are found in the cervix, many times the doctor will suggest removing them. After the removal of the cells, sometimes part of the cervix is removed as well. If the cervix is removed, this will oftentimes lead to infertility for the woman. Thank you for tuning in to this informational announcement about STIs and infertility. I hope that you're now aware and will take precautions to prevent STIs, which will also prevent infertility for yourself.